Who is going to present third task?
Suzanne.
Okay, Suzanne, Dr. Suzanne. There is one prop. In this task, always there will be a prop. Okay, consenting task. So even I have prepared a prop here. Started your 10 minutes time. Sorry, 2 minutes time.
Okay. Mm.
2 more pages, huh?
Okay, second one. Okay, next.
This is prop.
Yeah.
Started your 10 minutes time.
Okay, hello, I am Dr. Suzanne, one of the doctors here in the clinic. Can I confirm your name and age, please?
Yeah, doctor. I am Serin and I am 46-year-old.
How I call you?
Serin is fine.
Okay, Siren. I am here to discuss with you your consent form about removing or your womb. Do you have any other concern?
I just wanted to get it removed, doctor.
Okay. First of all, I want to apologize about my consultant, Mrs. Smith, is not here because she had a very busy clinic. So I will be instead of here, I will fix for you another appointment with her. It's okay for you?
No, I had just met the consultant. He said that I will be seeing you for this consent procedure.
Mhm. Yeah. So I will tell you about the surgery itself, the pros and cons of each step, and then I will give you the consent form to fill it. And this consent will be in two copies, copy with you and a copy in the file. And then if you want, I will address your concern if you have any concern. I write for your GB and give you also patient information leaflets about removing the womb to know more about that. It's okay for you?
Yeah.
So I want to ask you a few questions before I start. It's okay?
Yes.
So, Sirin, can you tell me more about your condition?
Yeah, doctor. Actually, this is my heavy bleeding has started almost 3 year back. Initially, I visited a GP. He used to give me this tranexamic acid. I used to take it. Eventually, the flow was increased, the frequency increased, and then this pain has also started. Since last 1 year, I'm seeing Mrs. Smith, your consultant. And she was also not very keen. She kept on saying, no, this you try medications like progesterone, oral pills, tranexamic acid. I tried everything. At a time, I started bleeding so heavily. I had to give they gave me a blood also. So I'm just tired of all these things. And then she has advised scan. They said that my womb is little on a bigger size, and now I have just decided, no, I don't want it. Me and my husband, both of us, have decided to go for this removal. So you just go for this consenting procedure.
Yes, sure. You have all rights for that. I want to apologize about what you gone through it from this difficult time. And also, I want to reassure you, you will, if you have any concern, I will answer this concern. And I want to continue asking about your condition also. You have any other test rather than the ultrasound,
No,
blood test?
my blood is normal now. I'm on iron preparation.
Mhm. Okay, so I will review your notes to know about your results. Do you have any other medical condition?
No,
Do you have any surgery before?
no,
Do you have any allergy?
no.
What about your pregnancies before?
Actually, I'm having two kids. One is 10 year, one is 8 year, both delivered vaginally.
Mhm. Do you have any future plan for pregnancy again?
Doctor, I'm 46 now. I don't want to have more babies. I'm
Mhm.
just,
This we need to confirm that you completed your family before we discuss about surgery. Okay, Siri?
yes.
Okay, so do you have any support at home?
Yeah, my husband is very supportive.
That's good to know. What about your last menstrual period?
It was 10 days back.
Do you use any contraception?
My husband using condom.
Okay. So what about your cervical smearing?
Yeah, my smear last 6 months back was normal.
Okay, your blood group?
A positive, and I will accept blood.
Okay. So do you smoke or drink alcohol?
No, I don't.
Okay, I appreciate that. So coming now to your concern about this consent, can we go for the consent?
Yeah, I will be happy to go for it.
Okay. Look with me here. This is the consent form. I will tell you about the surgery itself. Your surgery will be to remove the womb and the tubes also to prevent this bleeding to happen again. The removal of the tubes also to decrease the risk for ovarian cancer if you consented
Okay.
for that.
Yeah, yeah, it's okay, doctor.
Okay, this will be through the skin incision in your pubic hair, and then we'll go inside after you have an anesthesia or sleep. The sleep doctor will discuss with you about that. Then after we
Uh,
go,
yes.
mhm, okay, after we open the tummy, your tummy, we remove the womb and the tubes. Maybe we have, if you consent to remove the ovaries or no, according, we remove or not. Then after that, we close after be sure about no bleeding, we will close the tummy. And you will have after procedure recovery steps. Okay,
Okay.
that is for the surgery itself. Uh, Coming to the risk for this surgery, as this surgery is safe but has some risk for bleeding, so may be needing for transfusion, blood transfusion,
Okay.
and also maybe risk for infection. You will give given the antibiotic after exclusion of any allergy. You maybe have some injury to nearby organs and also the anesthesia risk. I'm clear so far?
Okay.
Coming to the frequent risk like pain after that, the wound may be healing, not probably. This is more risk. I'm clear
Okay.
so far. Have any other concern?
No?
Okay. So here, if you opted for transfusion, we'll take here. Then, if you agree about the surgery and discuss with the anesthesia doctor, you will be after the anesthesia doctor will be discuss with you. You will be choose the anesthesia route. After that, we will assign here me and you. And if you want to this copy, this consent will be in two copy as I told you. If you want to withdraw at any time, you can, even the day of the operation. I'm clear so far?
Okay. Quite clear, doctor.
Okay, as you understand me and you can decide and you can sign this one, this consent, you will have the copy with you. And I will give you also the patient information leaflet to read more and take more information about that. I'm
Okay.
clear so far?
Yes, doctor. I just wanted to ask you, can't the consultant go ahead with this keyhole surgery? Because one of my friend had a keyhole surgery and it was very quick for her.
Yeah, I appreciate your concern. You can go for the keyhole surgery if the womb is size is less than 16 weeks by examination. So before that, we will examine your womb and decide about the size. If it is less, we can go for the keyhole surgery and vaginal removal of the womb. But if it is more, as you tell
It is
me in the
less
ultrasound,
actually. It is less actually.
okay, after I review your notes and the results, if this is suitable for that, we will discuss with you the keyhole surgery about the risk and benefit of that. I'm clear so far?
Okay. And how means how will be my post-surgical recovery?
Okay. After you finish the surgery, you will stay at the hospital 1 to 2 days, according to sometimes 3 days. And you can return to your work within 2 to 4 weeks, according to your work, hard or not. And sometimes it is till 8 weeks. For six, you can resume your six within 2 to 4 weeks, according to your condition. After that, you can speed your recovery by stop
I'm giving you
and
additional 2 minutes. Okay, additional 2 minutes I'm giving you. Yes.
okay, thank you. Okay, so thank you. I will give you this patient information leaflet and this copy to sign it.
Who will be
Thank
doing my surgery?
the consultant, Mrs. Smith. She will discuss with you again, and she is the one doing the surgery with the team of multidisciplinary team, anesthesia doctor, and specialized nurse. And the physiotherapy after the operation will discuss with you the exercise after that.
Okay, and when can I join my work back?
I told you you can go for work within 2 to 4 weeks.
Okay. Okay. Thank you, doctor.
Any other concern?
No. And when can I have my sex surgery?
This is I will contact with the team for the waiting list to be hurry in this in the list, and during this time we will can use another methods for stopping the blood. We have the ablation, if you what is called the ablation, endometrial ablation. We have IUS or the intrauterine system. This
No, I don't
device
want.
inserted
I
inside.
don't. No, I don't want to listen about that, doctor. I'm very
Okay.
keen on surgery.
Okay, so I will give you also contact number. If you have any more bleeding or more pain, you can contact us at any time.
Thank you.
Thank you.
Okay. Anything else you wanted to add? Shall I stop it?
Uh,
Yeah, last. 4 5 second. Okay. Your own feedback. Then I would like people to comment on her performance. Your own feedback. What do you think?
Me?
Hmm?
Uh, I think I covered most of things, but time management is not good.
Yeah, 1 point. Anybody can come up with precise feedback. Then I will go through feedback and answer key. Fast, fast. Huh? We are already running out of time.
Ma'am, actually, I couldn't clear her voice because of my unstable internet. But laparoscopy, keyhole surgery, I think she is not, the consultant is not doing it. To refer to the other consultant for doing
Yes,
keyhole.
yes, yes, yes. Right. She couldn't acknowledge the information. Correct observation. Anybody else?
And the history could have made it shorter because the main task is
Consent taking.
concerned. So aware of the other options, she is aware, but she wanted surgery. Then any medical, surgical comorbidities, any risk factors, and ovarian preservation she discussed are not time. Not sure.
She has mentioned that depending upon the risk, we will decide at that time. She mentioned that.
And subtotal in case of dense additions.
No, that is okay because she is low risk. She's not having previous to LSCS. She's previous FTND. So we can go ahead with the total abdominal, not a problem. Anybody else? While taking consent, somebody noticed that did she write my name, NHS number?
As I confirmed in the first, I need to again tell her I will write your name and number.
While taking consent, when you were taking my consent, you are supposed to write down my name, NHS number on that consent paper.
I suppose this done when I speak to her from first. I tell her what's your name and number.
No, no, no. That is an introduction. That is an introduction what you are having with her because you are confirming that the patient sitting in front of you is Mrs. Serin. Okay. But when you started writing consent, you started explaining me in details about the steps of hysterectomy. I am not interested in steps of hysterectomy. You need to write it down my name, NHS number, age, DOB. Here also, here it has not been mentioned. See, patient identifier and label. So basically here you have to mention the patient's detail.
Mhm. Yeah.
So that is patient safety point. Unless and until you will not write and you will, unless and until you will not write down my name, how I'm going to sign it. Okay, so that is very important patient safety point, which was missed by you. Hmm? Anybody else wanted to comment on anything? Okay, so coming to the feedback, introduction good, setting agenda, concerns, aim, situational awareness. You need to have a very good situational awareness. You missed out on that. I will comment about that. Then the history was little lengthy. You could have cut short it because the main task is consent taking with addressing her many concerns. Okay, although it was a relevant history, but why you took so much of time while doing taking history, I will tell you. BMI you missed out, but apart from that, everything was normal. Now check my understanding what I know about hysterectomy. That is very important question which you have to ask. Means whether I am aware about hysterectomy. What does it mean to you? That means you are not going to get pregnant in future. You are not going to get your periods. So those things you need to explain her. A surgical method of removal of womb. Then taking a consent, you took a consent, not mentioned my name, NHS number. So that is again, the consent taking is not valid. You will not pass if you will perform like this in the real exam. Okay. Uh, Clear, crystal clear feedback from my side. Okay. Then you offered me patient information leaflet. You offered me recovering after the post surgical history. You addressed my concerns very nicely. Uh, then you have to put me on the waiting list. Okay, so that you have not put. You put me on after 10 minutes, after the 10 minutes time. Okay, so ensure that you will put me on a waiting list as early as your consent will be completed, and then you will ask me my concerns. Okay, you put me on that last 10 minutes. Lastly, when I said anything else, then at that time you remember, oh, I have to put her on waiting list. Then at that time, so these are the points where you need to improve. Now coming to situational awareness here, the consultant has asked you, which is Mrs. Smith, okay, to take a consent from the patient. That doesn't mean the consultant is absent today. He is very much there, but consultant will not take a consent. He has asked you to take a consent. So your situational awareness, he is not absent. Miss, may I confirm your name and NHS, name and NH? My consultant has asked me to take a consent for hysterectomy, abdominal hysterectomy. Am I right? So that is your situational awareness. Okay, he is not
Mhm.
absent, because this is
She
her
has
fifth
very
visit.
very
Yeah, this is her fifth visit, and she has
Mhm.
requested for hysterectomy multiple times. Now the next situation here is she does not perform surgery laparoscopically, but she can perform it means she can, the other consultants are there in the hospital who performs this laparoscopic hysterectomy. That means in that case, if I ask you, can you be offering me a keyhole surgery? In that case, yes, you can be offered very easily if less than 16 weeks. In that case, my consultant will not be doing it. I will have to refer it to the another consultant, and then you have to again go a long way, because she already on nearing now she's already on the waiting list. Here she's on the waiting list. There she will be taking an appointment, and then again she will be put on a waiting list. So it will take little more time. Okay, no harm in explaining her that my consultant is not expert in doing laparoscopically. In that case, I have to refer you to the another consultant, which will take time. As of now, you are putting, means as of now you are on our waiting list, but if you wish, we can refer you to another consultant who will be performing this procedure, but it will again take some time. That's it. You are not forcing her to change her mind, but you are just telling her the realistic picture. Okay, so this is actually things. Now coming to the time management, what is happening, you are using so much of paraphrastic sentences, acknowledging patient's problem. So those sentences, if possible, you can cut it short, because we entered into the first question of history taking by 1 minute 40 seconds. I will suggest you to cut it down by 1 minute. Okay, so your introduction part, the first part, introduction, concern, setting agenda, and aim should be completed by 45 seconds. You took extra 1 minute here because you are using sentences again and again. Those paraphrasing sentences, you can minimize that, because again your time will be compromised. Again, also after that also you used many points. By that your our history was completed by 5 minute 10 or 20, 10 minutes something something. Okay, and then explaining me about, you forgot to check my knowledge about the surgery. Okay, then you started explaining me in detail about hysterectomy, but in our task we just need to take a focused history, counsel me appropriately, counseling appropriately, obtain consent for surgery, and her onto and keep her on the waiting list. So consent taking is an important point. You do not need to see in one word. You could have explained me hysterectomy. Do not take it in other ways. Hysterectomy is a surgical procedure where we are going to remove your womb by giving a cut on your tummy. Okay, uh, it will be done by the experts under anesthesia. That's it. No need to go in detail. You are going to open, you are going to see, then the wombs will be removed, then the ovaries will be deciding. So when you are taking a consent, at that time only you have to decide what you are going to do with her ovary. At that time you can ask her whether there is any family history of ovarian cancer, any other cancers, or whether the ultrasonography showed any abnormal ovarian pathology. That two history you can take it at that time. So that there also again you deviated from your task of taking consent, and you entered into the task of explaining me about the hysterectomy, which was not my task. And then I had multiple questions which you had answered. Okay, so that's the reason our history taking and timing was mismatched. So this is a feedback from my side to you. So if we see the answer key, what I had prepared here is introduction situational awareness, that is ST5 in gynae clinic, obtain consent for abdominal hysterectomy as per consultant's instructions. Okay, he has asked. So gather few details, signed of consent if she is okay, because here I am very desperate, so I would like to have that consent signed off. One copy with me, one copy with you, as you rightly mentioned. Any specific concerns or expectations? As of now, hysterectomy is my concern. Once we had completed the consent, I do have 2 3 questions. Details of heavy menstrual bleeding, treatment tried. I told you, I had given you a clear cut idea how was it, how what treatment I took, and now I am on tranexamic acid and means iron supplementation, but I'm just getting very much bugged off with this period. I just want to get rid of it. Okay, you acknowledged my suffering very nicely, apologized that for my suffering. Smear, contraception, LMP, important history, obstetric history, because you wanted to know what was the mode of delivery. Medical comorbidities, any other surgery, allergy, smoking, BMI, blood group, JOA, support and occupation, because we need to see whether she will be having adequate support. Checking background knowledge about hysterectomy is important, what she knew. So it's a surgical method of for the treatment of heavy menstrual bleeding. It's a definitive method. Okay. The biggest benefit of this will be it's a permanent method where you will be getting relief from your bleeding. Hmm? So it's a permanent method, but as it involves surgical removal of womb with or without ovaries under anesthesia. So this is basically we are explaining her about surgery. So let's take you through the consent procedure. So the name and name of your you in details with NHS number. So I can just start writing here. You are just going to explain her in a simple way that this is my consent form. I will be starting writing down your details and will be explaining you simultaneously. So you can hear in the real exam, they might give you a prop also in the form of consent paper. So you have to fill it up. Okay. Name of the proposed procedure is, here I had used short forms, but in the real exam, do not use short form. We have a legitimate writing. Okay. Crystal clear writing. If you think that your writing is not very good, write it in a bold manner. Bold manner. Okay. Bold letter, not a bold or capital letter, not small letter. That is abdominal hysterectomy through tummy for the removal of womb. Alternatives. So did someone discuss with you alternative? Would you like to discuss? Because there are alternatives like LNG, IUCD, GnRH or endometrial ablation. No, I don't want to discuss. I am just fed up. I just wanted to go for hysterectomy. Okay. So this is the procedure. As it will be having benefits, there will be certain risk, as you rightly mentioned. Okay. You mentioned about the risk associated with this. The more frequent risk will be infection, bruising, urinary tract infection, readmission, and it will cause sometimes surgical menopause. The serious risk here will be thromboembolism, that is a blood clot, blood transfusion, injury to bowel, bladder, ureter, and sometimes we may have to reoperate. Okay, reoperate because of some complications. And occasionally what we have seen that many caskets of event related to each other, we have come across a death in rarest of the rare cases. We just need to be very open and honest. This is not to scare you, but this we have come across in once in a while of our life. Okay, so this is just not to scare you out, but just to give you a clear cut idea about the consenting procedure. Very nicely you mentioned the anesthesia will be either a spinal or a sleep anesthesia, will be decided by the anesthetist. They will review you in the pre-anesthetist clinic where they will do certain tests. I had mentioned that eventually, but they will be seeing you. They will be doing certain tests, including your full blood count, urine routine, imaging, and urine pregnancy test also. Okay, so they will be assessing you. Extra procedure, what we are going to do here will be either a blood transfusion plus or minus ovarian removal. If there is any history of ovarian pathology, any history of family history of ovarian cancer, then in that case, we will consider removal of ovary. Otherwise, we can keep the ovaries as it is. If removed, it will give you surgical menopause and need for hormone replacement therapy. So we will be keeping it. This is all about consent procedure. If you are okay, you can sign it for me. I will also sign. This is the simple terms what you have to use. You sign, I will stamp it. One copy for you, one copy with me. Okay. This is the consent procedure completed. Prior to surgery, you need to be in the best possible health, continue your iron supplementation, and we will do a full blood count, urine routine imaging, urine pregnancy test, and to be reviewed by anesthetist. Also, you will be seen in a pre-anesthetist clinic for the PAC purpose. At any time prior to surgery, you can withdraw your consent anytime. Okay, you mentioned that also. Two copies, one for you, one for me. Uh, and once we had done, now you are need to put her on the waiting list. So now I will check with the consultant regarding the list, and we'll put you on a waiting list. Okay, so we'll give you a tentative date or waiting list schedule. Do you have at least you utter that sentence, because even we do not know when you are going to be operated, but we are just going to consultant and will put you on that waiting list. Do you have any other concerns? How long will I stay in the hospital after the surgery? Once started mobilizing, eating, drinking, opening bowel, bladder, after about 48 hours to 72 hours you can be discharged. Okay, so that question was addressed very nicely. Why can't I have a hysterectomy through keyhole surgery? In that case, your request will be shared with the expert consultant who will be competent in performing surgery. As our consultant is not expert in this case, this might take some time. We have to give you our next referral. Okay, this will take some time. How soon will I be able to get back to work? So this is not a keyhole surgery, so you can mention 4 weeks, approximately 4 to 6 weeks time. 2 weeks will be in laparoscopic surgery. Here you can roughly mention 4 weeks time. Or if you don't want to give her adequate time frame, you can just tell her, once you started feeling better off, you were able to carry out your own work, you can join the work. Okay, you can join the work if you don't want to give a fixed time frame. Who will be doing my surgery? Expert competent person will be doing, either the consultant or a trained doctor under his supervision. Okay, can you just repeat what we discussed? So something like that, because they had mentioned that you just need to assess her mental capacity. So that's the reason I had put this question, but this is an adult patient, we do not need to assess the mental capacity here. The answer key was mentioning that, that's the reason I have just mentioned this. So can you just repeat what we had discussed? Shall I share details of consent document recovery after abdominal hysterectomy with you? That will be your patient information leaflet here. Shall I document and inform consultant and put you on a waiting list? This way I will be closing this task. Now domain wise scoring, appropriate fertility focused history, exploring fears and concerns, review notes to familiarize yourself with the history, investigation, imaging, definition of the size of the uterus, any adnexal masses and treatment so far, confirm information in notes, main symptoms, duration, impact on patient, investigation and treatment, explore other options not offered so far, that is Mirena, endometrial ablation, progesterone receptor modulator, MRI guided. So history information gathering, you took very detailed history, so I will give you clear pass here. Excludes pregnancy and advice to take appropriate contraception prior to surgery. This was not addressed here. Initiate appropriate investigations to suitable for the suitability of the surgery. Full blood count, urea electrolyte if necessary. For example, if fibroids are huge and could potentially compressing the ureter, it was not huge here. Okay, any contraindication to laparoscopic surgery? From the history you can make it out that there isn't any contraindication to the simple surgery as well as the keyhole surgery. Communication with patient and families, introduction, self and role, discuss the details of the procedure including complication, post operative procedure. Explore the routes of the surgery. If the uterus is not above 16 weeks, laparoscopic and vaginal. Discuss the anesthesia and options. Explain options of endometrial ablation, Mirena and others. Follow the procedure for obtaining consent. Here is also I am giving you clear pass. Confirm date and surgery with the consultant, which you had missed out. Refer patient to pre-surgery anesthesia review, missed out. Inform waiting list to the team and manager, missed out. Consider referral to laparoscopic team if uterus is less than 16 weeks. So here I am not going to pass you. Patient safety, confirm details of the patient at the start of the task, ensure there are no contraindication to the surgery. This was mentioned. A certain no allergies that could be affect safe prescription. Confirm that transfusion will be accepted, and if not, in case of Jehovah Witness, makes appropriate arrangement. Consent form signed, dated, copy given to the patient. So this consent form was not appropriately filled. No mention of the name, no mention of your own signature. That's the reason I'm not going to give clear pass in patient safety. I'm going to give you borderline in patient safety domain. Okay, patient safety continues here. PSC alternatives discussed. UPT rule out pregnancy prior to surgery. Withdrawal of the consent when if possible. That also you explained. But no clear pass in patient safety. It will be borderline. Discuss the details of the procedure and the indication. Aware the alternatives to management. Aware the principles of consenting in medicine. Familiar with the NHS consent form and procedure and able to use information and leaflets from RCOG. So you had given me leaflet, but leaflet will be of the recovering after hysterectomy, abdominal hysterectomy. That will be the leaflet what you are going to give me. Anybody is having any question? No question?
I mean, the exam